Пожалуйста, надо было предупреждать нас, что
distinguished lecturers, colleagues. My name is Sami Ismaila from 87th Group 6 course. I'm here to present on pregnancy and hematological diseases in sub-Saharan Africa. Now we understand that sub-Saharan Africa refers to the regions in Africa that are below that are within the Sahara region, excluding 6 North African countries. Now, out of these sub-Saharan countries, I am from one of the countries, which is Nigeria. So most of my reports will be relating to things I have seen or observed in Nigeria. We understand that epidemiologically, if you check this slide.
Уже переводить синхронно. Ну, мы сказали о том, что это африканская страна, которая находится возле Сахары и представитель Нигерии. Ну и там 6 окружающих стран.
Okay, in epidemiology, we discovered that about 20% of maternal death results from anemia.
Значит, 20% материнской смертности в Африке связаны с анемией.
And as a result of that, my presentation today will be focusing on 2 major causes of anemia in sub-Saharan region, which is iron deficiency anemia and anemia due to malaria.
Значит, вообще анемия и анемия при малярии.
Okay, we understand that there are physiological changes that happen during pregnancy, which include a 50% plasma expansion that is not concurrent with increase in hematocrit value. What I mean is, during pregnancy, plasma volume will expand by 50%, but RBC mass remains the same.
Значит, это когда плазма не увеличивается количество плазмы, и эритроциты как бы не успевают увеличиваться вместе с объемом плазмы.
So, as a result of this, we understand that the precise definition of anemia during pregnancy varies because we have different values of hemoglobin in whites and in blacks, different values of hemoglobin in pregnant and non-pregnant women, and then different values of hemoglobin in women that receives iron prophylaxis and those that do not.
Значит, будет исследование посвящено разнице между гемоглобином у белых и темных женщин, у беременных и небеременных, и с железом дефицитной и нет.
So, but simple definition of anemia, we understand that we can clinically conclude that a woman or a pregnant woman has anemia when she has blood level of hemoglobin less than 11 grams per deciliter.
Значит, да, анемия это когда установлен, когда меньше, чем 110 грамм.
So, I already explained that today we'll be focusing on 2 main causes of anemia, which is iron deficiency anemia and then malaria. So I'll be starting with iron deficiency anemia. We understand that a pregnant woman requires about 3,000 to 4,500 milligrams of iron during pregnancy. And most of this iron she gets from her diet. So during pregnancy, in the 16th week, compared to the 36th week of gestation, we understand that there is a 9-fold increase in iron demand during pregnancy.
Значит, связана железодефицитная анемия, связана с недостаточным потреблением железа, которое необходимо во время беременности, увеличивается потребность.
And so, as a result, most pregnant women come down with iron deficiency anemia, especially those that do not get prophylaxis of iron during pregnancy.
Значит, в основном она проявляется, что она гипохромная и микроцитарная.
Okay, so what we must understand is that iron deficiency will result in anemia, and we understand that once a pregnant woman has anemia, she will have low birth weight, and it increases maternal risk of death as well as increases pathologies in the newborn. For example, the neonate may have low birth weight also and increases risk of neonatal mortality. So what do we do normally? In Nigeria, for example, there's prophylaxis for when a woman gets pregnant. There's iron prophylaxis, as well as during pregnancy, if they measure her iron value and it's decreased, there is need to administer drugs. So as a method of treatment, it's usually advisable to administer 200 milligrams of iron, and then accompanied with 5 milligrams of folic acid, because sometimes iron deficiency anemia is maxed. It maxes megaloblastic anemia due to folic acid deficiency.
Значит, в основном сказать о том, что для лечения мы используем препараты железа и фолиевую кислоту.
malaria. Now, malaria, we understand that is a tropical disease that is caused by a parasite known as Plasmodium. Now, Plasmodium have different species like Plasmodium falciparum, Plasmodium vivax, Plasmodium ovale, Plasmodium knowlesi. Now, all these Plasmodium species can cause complicated and some cause uncomplicated malaria.
Малярия, ну, вы знаете, какими видами плазмодия вызывается, она может быть осложненной или неосложненной.
Then, now, take note of this statistic. In malaria accounts for 9% of maternal-associated mortality, which is about 5,300 maternal deaths annually as a result of malaria.
Значит, рождается, да, анемией, и которая в 9% случаев вызывает смертность, материнскую смертность.
So, the transmission of anemia, briefly, it can be high transmission setting and low transmission setting. High transmission setting means women, or that's pregnant women that have acquired immunity against malaria. So even if they are bitten by a mosquito, that is the Anopheles mosquito, the Plasmodium parasite will be present but no symptoms, asymptomatic.
Значит, есть женщины, у которых есть как бы защита от этой анемии, а есть женщины, у которых малярия возникает асимптоматически.
Now, but in the low transmission setting, such pregnant women have low immunity. So as a result, once they are bitten and there is transmission of malaria, they will develop symptoms which include maternal death in complicated cases, and in some cases you see neonatal mortality, low birth weight, and the rest, and other complications during birth.
Осложнения в основном связаны с анемией, и, соответственно, тяжелая степень анемии вызывает смертность естественно.
So, World Health Organization recommend two prophylactic measures. One, there is what we call long-lasting insecticide nets. Long-lasting insecticide net as a prophylaxis for pregnant women whether in the rooms or in the hospital. They should sleep under mosquito-treated nets.
Значит, используются препараты, которые длительного действия, противоинсектицидные для лечения.
And then the second preparation is, they call it intermittent preventive treatment in pregnancy, which is a combination of sulfametazine and pyretamol, okay? Which is a tablet that is taken about 600 milligram dose orally as a prophylactic measure against malaria.
И во время беременности профилактически тоже назначаются препараты.
Thank you for listening.